Cindy?
Or the sides.
Oh, or the sides. Okay, so you'll need to go to a microphone to ask your question so the live stream audience can hear the question, and then we can share the mic from here so that they'll hear us as well. Okay, so are there any live stream viewers that have questions right now? Okay, first of all, Dr. Mattson has to leave in about 30 minutes, so if there are any specific questions targeted for her, let's take advantage of her limited time first. Okay.
Hello? I haven't read the question yet. It's working?
Yeah.
All right. It seems that JS kids and adults have varying levels of speech and language. Is there a known link to a gene that relates to the voice box sound? For instance, my daughter has started to vocalize more, but some sounds seem challenging to her, and she whispers some words where others are loud and clear.
You want me to answer? Okay. All right, so the question I think kind of comes down to, are there any underlying craniofacial abnormalities that might affect vocalization, if that sounds like a reasonable way to summarize the question. Pardon me?
She was asking about genetic.
Right, so there are certainly actually several candidate genes in 11q that probably contribute to the craniofacial abnormalities. Dr. Mattina alluded to that this morning. The one that I talked about, ETS1, might have one. So in theory, yes, but I don't have any specific answers to that question.
Clarification, is it certain words that your daughter will whisper only? And other words she speaks in the usual way? Well, I'll share with you what I was thinking. You know, it could be an atypical form of selective mutism. I mean, that's a form of anxiety where usually kids between about 4 and 8 years of age will only speak in the home or in front of people that they're comfortable with. That is their primary attachment, usually a parent or all the people in the home. But they won't speak at school and the playground to the teacher or peers. And it's a form of anxiety. And I'm wondering if this is just a variation of that.
What a couple of different answers. That's really cool. That's great. That's why we do this as a panel.
One's from the lab, one's from the street.
And which one makes a hell of a lot more sense, right? No. You do have a few more gray hairs today.
Hi, Stephanie. My daughter Sydney's turning 8 soon. And Sydney has started to develop behavior just within the last, I'd say, year or so, where she constantly is asking what's next and what the schedule is. And I can't tell if it's an anxiety thing that it helps her feel better, or if it's kind of, we were talking about autism, maybe it's a sign of autism, but she constantly needs to know the schedule, what's coming next, what's coming next, what's coming next, and asks it over and over again, even after we answer her question. So I'm just wondering if you have some thoughts on that, whether that's anxiety or more a behavior thing with autism.
In the past, when she was younger, did she seem to engage in other kinds of repetitive things or need to kind of have, or did she have difficulty being more flexible with unexpected events?
Not really. She's never really had a problem with adjusting to changes in the schedule. She does better on a schedule at school, but most kids do.
Right.
But has not really had a lot of problems if we change the schedule. She's been pretty okay with it. It's more, everything's very forward-thinking with her right now, again, in the last year or so, where, what are we doing, where are you going, then what, then where, then what, you know, she just needs to know over and over again what's going to happen.
Mm-hmm. Is she able to talk about other things more flexibly, or is that sort of her main means of kind of sharing
a lot of other things.
Okay.
Yeah, she does. It's just, again, several times during the day, ask those questions.
Even though you...
And of other people, too. Where are you going? Where are you going next?
Uh-huh.
That's what
Yeah.
with that pattern, do you try purposefully to inform her what's happening next? In other words, review the day or review portions of the day before they're happening?
Actually, not as a preemptive type of thing.
Well, that's the relatively simple behavioral approach to what you're describing, and I see that in a variety of children, some on the autistic spectrum, but some not, and I do see it as a form of anxiety, but it's very very specified. But I think the behavioral approach is to preempt it. In other words, constantly be preparing her for the next event.
Okay. All right, and I think we could implement some of that in school too, I'm thinking.
Yeah.
Do that in the morning with her.
Some of the kids at school on the spectrum actually have a visual schedule of what's going to happen during the day. So it could be that she has that at school already and it's comforting for her, and maybe using some sort of a schedule. Maybe she forgets. Maybe have a schedule.
School, so, yeah, and we can see how we did that at home. She can see what's coming out. Yeah, great, thank you, very helpful.
On the same note of what you were talking about, and you guys as well, one of the things that my daughter's 26, we recently had about a year and a half work with a behavioral therapist that would come to the house and work with us as well as my daughter. And one of the things that she implemented is, like you said, the visual markers for her reward system. And, like if she got 5 stars, then she got her phone for the next day. And if she, did her chore list, then she got a star. And if she got so many days, like 5 or 7 days in a row, then she could have a day out. And then so we progressed the reward system that way. But in the bathroom and in the shower, we have the color stickers. Number 1 is wash your hair. Number 2, is conditioning. The 3 is the body wash. And then we just put the piece of tape on the new bottle of soaps so that they match the colors. And she knows if she was number 2 or number 3. So that gave her a little bit of a defense about us having to bath shampoo, or having to continually digest the same bottle so she would recognize it. So, and the same thing in her room, there's a little Velcro plastic things that we put on her. If you make your bed, you get your clothes, in the bathroom, you brush your teeth. And she can move them from one side to the other when they're done. And then I can check them and say, oh, you got a star. So that seemed helpful too, because then she knows every day what she's doing, because when she doesn't, and she will make sure that she's not having her cereal at 7 a.m. because there's not enough milk or there's not enough cereal. At 7 a.m. there's none, because she will come and say, there's no cereal, there's no milk, I don't have my stuff. You better get up and fix it, it's going to go all day. So definitely something helpful.
You just gave the best description of behavior modification I think I've heard. And congratulations. It's nice to see that it's working too.
For that time period, so I was saying, I was like, somebody can help, you can't take meds right now.
Yes, I have a question.
Okay, let's.
My son is 15. He's verbal, but expressive. Verbal is not. I ask him, how are you? He's happy and fine. Even if his face tell me different, that he's maybe sad or something is going on, he's always happy and he's always fine. How me as a parent can detect any depression? Because he's always anxious, and I know that. And also he has an event this year at his school. They lost 2 kids close to him. So how can I detect any type of depression when he cannot express himself?
Well, obviously from the response in the audience, all the families know that's a tough one. However, one thing I would have done when you say two of his peers in school died, however that happened, and you expected him to experience some sadness and express that. So at a quiet moment, you might sit down with him and say, it really feels sad to me that whatever the name is, lost her life. You know, I miss her. You say that. And then see what his response would be. In other words, you're modeling an emotional response to a loss. And that may be helpful. And you can model even other things too. You can play games with him, you know, about happiness and sadness and anger.
I'm really open with him. I talk to him, explain to him. He knows now what is, you know, losing someone. He knows that he's not gonna see them again. But, you know, even though he said that he's fine. You know, I said, I'm fine, mommy. I'm okay. But I know that is not the right answer. You know, my thing is not only with this event, but maybe as life moves, how I can detect, you know, that maybe something just momentarily for a few weeks because we get sad, that's normal, but maybe something more serious that, you know, that I have to take a look.
So sometimes, and I don't know if your son is on the spectrum, but a lot of times kids learn scripted answers. So like when you ask, how are you? They learn that the answer is, I'm fine. And so one of the things through some behavioral interventions that can be done is to work with the child to help him understand and label other emotions. And I'm not sure if it would be that easy for you to do it yourself, but that might be something that you could think about in terms of a behavioral intervention to help him label other emotions that he has. Another thing that you might think about is ask him in a different way than how are you, you know. So say it in a different way so that he's not going to give you that scripted answer.
Our daughter seemed to develop normally from a cognitive standpoint until about 18 months, and then severely regressed, lost all speech, which she has not regained. We talked to at least one other couple that also had regression. Is that something that you've seen, or any explanation related to JS, or any other reason that you would see that the children would lose the ability to do certain things, like talk?
I can answer that specifically to Jacobson syndrome, and then maybe pass it to Marty, I think, who can give a much more elaborate answer. So there may be a couple other patients, children with Jacobson syndrome that I've heard of that had regression of their milestones. But in general, at least from my training, and I'm going to pass it over to Marty in a minute to elaborate on it, regression of milestones is very concerning for some organic process going on. So let me turn that over to Marty. And
I'm going to turn it over to my colleague on the right.
Yeah, it's interesting because I had another parent say that they had the similar sort of experience, but I hadn't heard that before this conference. So typically, that type of profile is what we associate with autism, where probably about 20 to 30% of patients do seem to have been developing okay and have a few words, and then around that time period lose those words and oftentimes lose other kind of social interest and other kinds of skills. And typically we say that if that happens, it's most likely to result in a diagnosis of autism, but your situation is more complicated because you have this other medical diagnosis. And so you know, I don't know that we have any other sort of explanation.
I have one.
Okay.
So what you described about the 18 months is very typical for kids with Rett syndrome. And in Rett syndrome, they have a lack of some growth factors, including brain-derived growth factor, BDNF, neurotrophic growth factor, and also IGF. So I'm kind of interested in knowing whether your child has low, be it insulin-like growth factor 1, IGF-1, and right now there are some clinical trials being done with Rett syndrome giving the IGF-1, and that might be something to think about for kids with regression in Jacobson syndrome.
I have a question around, one very frustrating thing for me as a parent is we hear reports from teachers and others that behavior is perfectly fine, they're complete angels, they can't believe that there's any reason why they would ever act out or have any type of behavior issue, but as soon as they get home and they get close to the ones they supposedly love the most, the behaviors are extremely bad in that there's self-injury, there's, I have one son who he will display his displeasure by blowing his nose and showing you the snot on his hands to show you exactly how upset he is and wiping it on you, flicking spit on you. But if he's with any other stranger or any other person who he doesn't know, or he's not at home, he's a complete and utter angel. And he's nonverbal. We've tried taking him to child psychologists to try to help with maybe working through this. Do you have any suggestions on how we might be able to, it sounds like I'm not the only person who has this problem. Any other recommendations, options, help?
I hear this a lot from parents, from children with lots of different kinds of conditions. And part of it, I think, is there's many different answers and responses. So part of it is that kids often do save their worst behavior for their parents, unfortunately. That's pretty universal. I think part of it is that in school things are oftentimes very structured and very predictable, but for lots of children, and so that makes it easier for them to kind of hold it together. And I think oftentimes when they come home, they're oftentimes exhausted, and they have a hard time now kind of following the rules and kind of acting more appropriately. That's part of it. And there are just different kinds of triggers in the home sometimes that set off these sorts of behaviors. So part of it is fatigue, the expectations, and kind of knowing what you're supposed to do at school and that you're not supposed to do those things with your parents, but they oftentimes do just come out, and the child isn't necessarily intentionally trying to just be horrible, but that's what you see is a lot of the really negative behaviors. What I typically tell families is to really work with someone who's very much of a behaviorally oriented type of interventionist to see what are the sorts of things that are going on at home, what are your responses, not that you're causing these behaviors, but how might you modify your responses to the child's behavior so that you can decrease the frequency of the negative behaviors and the intensity of them as well.
Right. And what you implied there is a behavioral therapist that actually goes to the home and observes for a while what those triggers are. It's very important. And the other, and I don't mean to simplify it because I would have suggested the same thing, try to find a behavioral therapist that can come to the home and work with you one-on-one. But, if you're in my office, just to give you something to go home with, I might ask you, have you tried ignoring the child when the adverse behavior comes out, literally ignoring even the snot episode, because you appreciate that your son is getting attention when you have a response. It's a human response. I mean, I probably would have the same response, but it does give attention to a negative behavior. Pulling away from that can be helpful.
Yes, my daughter is 9.5, and she has a similar problem as most people. They tend to bite or have oral fixations. My daughter doesn't bite aggressively, but she does, if she doesn't have something to put in her mouth, like we go back and forth between balls and paper towels, But if she doesn't have something and that she can bite either her hand or a ball or a paper towel, we always go back and forth. She doesn't seem to be anxious. We haven't been able to find any trigger, and I just, I'm kind of, I've gotten every response. Some people say it's not hurting anything, let her do it. You need to do something about it. So I'm just posing the question to the panel, what might be causing that? Is it anxiety? Is it just a behavior? She's not doing any harm to herself, but along with immune deficiencies, putting things in her mouth, we have an issue with that because she has hardly any T cells. So the question is are we giving her an opportunity to get sick by doing that?
It sounds like, one possibility is that it's a really sensory-seeking kind of behavior, that by doing that, from what you've described, that she's really kind of trying to make herself feel, or maybe serves a function of making herself feel better. If you can work with somebody to redirect the behaviors, that can be helpful, but in the interim, probably giving her something that you feel like is safe and appropriate, that you can say that's what you can use instead of other stuff in the environment that might be, not only harmful to her, but also just kind of more destructive and unpleasant, I think can be helpful. But it sounds like one possibility is a real sensory-seeking kind of behavior. She's frustrated, and that is a way of redirecting that behavior.
I don't have experience with this, but Margaret Bauman, who is a person who's been working in autism for many, many years, has, when I've been at meetings, has suggested that that kind of behavior may be related to reflux, and that treating the reflux might decrease those behaviors. So when she sees kids that are chewing and gnawing on things, she sends them for a GI examination. So you may want to, given that GERD is a big problem in kids with Jacobson's, you may want to look into that as well.
Thank you.
I have a question about speech. Christian was speaking in sentences really well. We've been working with him for pronunciation. And and also his speeches went downhill, but I took him, he has hearing problems. So I took him and reevaluated his hearing, which is not regressing. I thought maybe that was the issue. But these last few months, he's having a hard time with words he already used to know. And when he says things, he'll say a sentence which he used to try to pronounce before, and now he's not pronouncing them, and they're lumped together. He's really digressed, and I know it's not his hearing because I took him back in and had his hearing checked. Is there anything else that could be an issue or a problem as to why his speech is going downhill? And I don't think he's doing it on purpose. When I try to pronounce it with them, he's trying to pronounce it back, but it's not coming.
How old is your son?
He's 15.
He's 15. And this is the first time this has occurred?
Well, he's my foster son. I got him at 9 and he didn't speak at all then, but we've got him to where he speaks now and he says sentences. But a couple months ago, the sentences started regressing and his speech would be more of and then instead of speaking the sound.
Do you know if it's happening in other situations outside the house, like at school or with friends?
School's not great. We are having issues with schooling and where he's going to school and that kind of thing. Could that be?
Well, yeah, I mean, it could be situational. It could be an anxiety symptom, just like stuttering that comes on acutely. Might be related to anxiety. This may be a variation of that. But I would kind of check with the teacher and just observe him in other situations first.
Well, we've tried to do that, but nobody else, most people that we've tried to observe with don't expect him to speak back, so they don't even give him time. It's like there's no time there. I think we're the only ones that really expect him to speak back, which he did do, so I'm just stumped as to why it's not happening.
And the other thought is you could have them evaluated by a speech therapist. They may have some very practical, often do have some practical ideas.
Thank you.
I also wonder if, I don't know if anything's changed at school, but if the school isn't putting those same sorts of demands on him, they're not giving those expectations, because I saw you with him, really trying to prompt him, because that's exactly what it seemed like. He would kind of give a one-word kind of utterance, and then you said, and if somebody, if he was developing those skills and now they're not expecting that, so he doesn't have to do it, and either he's getting kind of ignored or his needs are getting met without him having to do as much work, then he's having a hard time in the other situation where you're placing those demands, and maybe he's a bit confused as to why is it that I have to perform so much, because he seemed pretty pleasant to me, but it was clearly not his go-to response anymore. Maybe he was more able to do that before.
And I did homeschooling for a year.
Okay,
And-
so yeah, so maybe that's just that change, that dramatic change in the expectation, that it wasn't all the time. That's could help to account for some of that.
Okay. And then I have a two-part question. It goes along with this question. We have different responses, and you might have just answered that. He is great around me and great at home, and he does great. We have behaviors when he goes to visit family, when he goes to visit someone else, when he goes to school, when he goes places, he's like a different anymore. Is there anything I can do other than tell him you need to behave or you can't go swimming? That works up to a point. I believe he knows. I don't know.
Yeah, it might be that he doesn't necessarily understand, all that's involved with you need to behave, because that's means a whole lot of complicated sort of steps. If you can have the other people that are with him when you're not there push him in the same way, give him the same sort of prompts as well as expectations, it'll be a lot easier. Because again, for lots of kids, it's confusing when the environment is so dramatically different. It's hard to be in a new environment if he's seeing his family, etc., and they aren't giving him the same kind of expectations and prompts, then he doesn't know how to behave. It's going to be harder for him, and he's going to be confused and frustrated and probably act out a lot more.
And just to reiterate, I usually don't say behave to him. I'll say, now remember when you're over there, you don't touch their dog. And remember, whatever it is they don't want him to do, I'll try to let him know ahead of time. Those are the things you can't do.
Yeah, and if it could be reinforced as soon as he gets there, and that the adults also kind of remind him, because that's a lot to remember over a period of time, might be really helpful too.
Thank you.
I have my grandson just graduated from high school, and he's 18. And in the last few months, and I know he's just so anxious about what's going to happen next. He started biting his fingernails, and so I took him to a psychologist, psychiatrist, and they put him on fluoxetine, the Prozac. And they put him on 20 milligrams, and he did pretty good. So, but he still had a few, he's still anxious. And so they put him on 40, and he started putting on weight. He slept all the time. The school told me, what are you doing? What's going on with Tristan? I told them, they said, get him off of it because we've lost our happy boy. It just didn't work for him. It did kind of at 20. I just wonder, are there other, and that's a serotonin, right? So, are there other good serotonins I should try? Maybe even cut the 20 into half, since this use propofol you think did better at 8 milligrams than trying to jump up to a higher dosage. Maybe he just, and I do think he's autistic. I never thought about it before, but I hope it's not too late to get him some kind of help, because I just think he has so many friends, and he's so scared that, he'll try calling them. Of course, they're gone for the summer and doing things, and he's very anxious about about what's going to happen when they're completely at a bigger college, and he's going to the community college and still has some classes at the high school. They get very anxious, with him especially. He's just like the person who said at 8, they kept saying what's going to happen, what's going to happen. That doesn't stop. They want to know what's going to happen daily, what's going to happen, and and they have plans. He plans on getting married and all these things, whether they come true or not. They have all these expectations. And he's just really nervous, but the medicine just didn't seem to, if anything, it was worse. It really was worse. So have you got any suggestions of what I can do to just...
Yeah, there are a few things you can do. With regard to the medicine, remember I said one principle of pharmacologic behavioral therapy is to start low and go slow. Well, the 20 milligrams for an 18-year-old was reasonable to start with, and I think, many physicians would go up to 40 milligrams. It wasn't wrong, but two thoughts. One, you can go down to 30 to see if he still has some benefit with regard to the anxiety and doesn't have those side effects, or you can go back to 20 and just accept that, and it sounded like it helped him.
Can you actually go lower? Could you take, do they make 10s or things like that?
Oh, yeah. Oh, yeah, you can go much lower. You can go much lower. And the other thing is, remember I gave you that list of about 5 or 6 different medications that were the serotonin reuptake inhibitors, SSRIs, and there's some variations of that as well. There's actually, if you look at the whole list, there's about 10 of them. So these psychiatrists could use one of the others, which may benefit the anxiety and may not have that side effect. You can't guarantee that. Bupropion, yeah, that's a...
Is that the same thing?
No, I was going to say it's very close in sounding, but it's not the same at all. No, it's the brand of that is Wellbutrin, and it's considered an atypical antidepressant, so it's primarily used for depression, although it does have some effect on core ADHD symptoms as well, but usually not anxiety, certainly not, usually not anxiety. But that's different. The point is that the psychiatrist has many choices. And the other thing is, I think it's not unusual for even typically developing kids to have a lot of anxiety between high school and college. So, I mean, with the Jacobson syndrome, there may be some greater vulnerability, to be sure. But one thing you can do about the transition is take him to the community college before classes start and walk around and maybe meet some of the people there and do that several times. That could be very helpful.
Can I ask Ms. Chugani, what were you talking about then? Is that a medicine or just something clinical? Bisoprolol? What's that one? Oh, I'm sorry.
It's buspirone, and it's another drug, and it's used for anxiety in adults and older children. It's just another class of drug. Instead of remember I told you how the serotonin transporter takes serotonin into the cell? So the SSRIs block that site. What buspirone does is it binds to a particular receptor called the 5-HT1A receptor. So it acts like serotonin at that particular site. So it's kind of two different ways to modulate the serotonin system.
Could that be something he could try?
If he's having anxiety, it would be something he could try as well.
Okay. All right. Thank you very much.
Okay, I'm a huge proponent of a behavioral intervention first. No surprise there. But Peter's behaviors are such that I think at some point he might need some pharmacological intervention. I am petrified, though, with all the side effects that are out there, and you know, he's actually a really good sleeper. That's something he does well, and I'm not willing to give that up, you know? There are other things too, though. I mean, I actually, when you mentioned Lexapro, one of my cousins committed suicide while on Lexapro. And so that what scares me, because they were monitoring him very closely, and he just didn't share with anybody what he was feeling inside and wrote it out in his letter. So that scares me, because Peter, of course, can't communicate as well as a typical child. And so as a parent, how do I monitor these things? How do I look for all of this? It kind of goes to your question before about like the depression. There are times when, you know, if I will reprimand him for something, he'll say, I'm terrible, I hate myself, and I don't know where he's getting these things from. And, you know, I don't ever tell him he's terrible. I'll tell him I don't like your behavior. I'm very, very cognizant of that difference. I don't know, maybe he's hearing I'm terrible when I say that to him. Anyway, I guess I'm just wondering, as a parent, how do I monitor this? All of these drugs, it's overwhelming to me that, you know, there's so many out there, and how do you know which one to even go for? And that's kind of a broad question, but I guess, I just don't know what to do. I mean, at what age do you find that medicines are most effective? He's only 8. Then there's puberty, when you know, mix that in there with the drugs, and there's so much out there, so many unknowns, and just like a little guidance on maybe where we should kind of how to navigate this.
Well, you're not alone in parents having concerns and fears about these medicines. You know, I was a pediatrician, general pediatrician, before getting into developmental behavioral pediatrics, where I used a lot of these medicines. But I'll tell you, it was almost 10 years before I really felt comfortable even using medication for ADHD. Although I did, but it took 10 years, and what changed is I saw so many children benefit by it with tolerable side effects, if they had them at all. Now, you know, so that was after seeing dozens and dozens, if not more, kids really benefiting from the medicine. Then I could feel comfortable with it. But as a pediatrician and a parent, you know, I had the same response you did. You want to find an experienced, knowledgeable, either child psychiatrist or developmental behavioral pediatrician that has a lot of experience with these kinds of medicines in children and communicates well with parents. You know, but no one, you're not going to get over that awful experience of knowing someone who committed suicide on Lexapro. Because Lexapro, you know, is one of these antidepressants, and that's not going to leave you. But the chances of that happening again, of course, very low. But we take risks with all these medicines. We take risks. I mean, you took a risk in flying here if you flew.
Well, I had to take a Xanax to do that.
I have nothing more to say.
Okay, I have a question, kind of going back to the dosages. My son is also on Prozac, but we've tried several different medications. Right now, same son who snots, spits, and cries all the time. So we do see a child psychiatrist, and he's been trying to determine what is causing all this. Because, like, we'll go to church, and he will scream and cry sitting with us, but if he just moves over, like, 2 pews with someone else, he'll sit quietly the entire time. So it's really like he can't be with us a lot of the time because his behaviors are so extreme, especially in public. And I don't know if that's anxiety related, but anyway, I digress. He's on Prozac right now, and we've tried several different medications for both my sons for different things. And we've done the start low and go slow. And with several medications, we found like when we start low, nothing, we move it up a little bit, a very slight change we see, and then for both my sons this has happened. We've gone up to the next step, and it's gone way, way downhill, like worse than it was to start out with. And I don't know if that's something that you see commonly with medications, or if it might be something related to the amount that Jacobson syndrome kids can tolerate. I did, when Dr. Chugani talked about the serotonin, you don't want high or low, I thought, well, maybe that's the explanation. Maybe we got too much serotonin through the Prozac because he was on, when we went to 20, it was a slight improvement, but 30 made him crazy. So I don't know if you have any thoughts on that.
30 made him great?
Crazy.
Oh, crazy.
Way worse than before.
Okay. Well, there's an easy answer to one of your observations and a more difficult response to the other. As far as the church episode, just put him in another pew. Forget about it, Yeah. I mean, he's sort of told you how to modify the behavior for whatever reason. You don't never have a reason, maybe, but but see, medications are like that. Your experience with these so-called psychotropic medicines that affect behaviors in the brain, your experience is not unusual, and that's what makes it very difficult. It is hit and miss sometimes. That's why you want somebody really experienced doing it, so they don't go up too high or don't go too low. Because that's the other problem. Some people are not bold enough to push the medicines up, or you might get a response. In your case, it was difficult at that time. But there's just no simple answer to that. I was taught something years ago, before we had all these psychotropic medicines, that medicines in general that can affect the brain do more so in kids with underlying neurologic disabilities. Now, I've never seen that proven in a general way, but I think it's true, So I'm not surprised to hear that in Jacobson syndrome there's more sensitivity with side effects to these kinds of medicines. And there's just no simple answer to it. It's trying different ones. And it's okay to try different ones, as long as it's an experienced clinician. I mean, sometimes they have to go through 3, 4, 5 to find some.
Anything on the live stream?
I'll do the second question since nobody else has something else, if you guys don't mind. Another sort of thing with Sydney's behavior that we've been struggling with is she understands consequences and understands that when she does something wrong, there's a consequence to it. She doesn't seem to care that much. She doesn't really internalize it, right? So she'll do things like she'll come off the bus and she gets happy faces and sad faces for her behaviors during the day. And she'll hang her head and say, sad face, hands it over, like literally fake cries. She knows she's supposed to be crying, but I know she doesn't care. She just doesn't. We put her in timeout or we take away the electronics, the things that she cares about. Still doesn't seem to care all that much. And I don't know if, again, sometimes I wonder if it has to do with her maybe being on the autistic spectrum, like doesn't really emotionally process things the way that the rest of us do. Because it's very rare that she cries. She's happy a lot, but she doesn't seem to process things emotionally, either consequences or I know somebody else mentioned loss of a friend. She lost 2 loved ones this year, and she fake cries about it. She knows she's supposed to, but I know she's not really feeling it the way that other people are feeling it. So I'm just curious if you have any observations on that. If there's anything you can do to kind of help her get in touch with her inner self or her emotions.
I don't know if I said this to you already, but the behavioral therapist sometimes can help the children recognize their emotions better, and they can have different programs to help them understand sadness and label it and so on. I mean, it could be that the consequences you have, she's just doesn't really care that much, or it could be that somehow she's not feeling the emotion, as you're saying. So I think those are the two different things. I don't know, do you have that?
Yeah, I think that it is, I've heard this from lots of parents, that there are these perplexing kinds of responses, and helping her to maybe understand what other people feel or what their expectations are, and that if she's not feeling those things, then kind of faking it isn't necessarily the, the response that you want. And maybe she's trying to please you in that way, but, she's trying to please you to either because she wants to sort of fulfill that expectation or to kind of get it over with in some way. So helping maybe, kind of a two-way road between understanding that these things may be hard for her to process in the way that we expect, and that doesn't necessarily mean that she, it's altogether bad for her. I think it is tough when kids don't necessarily respond as much to those reward contingencies, like, okay, you've done something wrong, and so I'm going to take this away. And again, if it's not really something that she is feeling that badly about, then it's not going to have the desired effect. And, the behavioral approach usually is if punishment is not necessarily an effective means for changing behavior, and so rewarding the positive behaviors can oftentimes make a much bigger, have a much bigger impact on the child.
Yeah, she got all happy faces the week that Grandma promised to trip to Build-A-Bear. She could get all happy faces all week, so she can do it.
Yeah.
Right?
Yeah, and so that was a really, theoretically that was probably a really big deal, not something that she gets very often, so she could hold it together, but it's not that if she doesn't do that every... Yeah, it's going to be really hard, and so, if you set the bar too high, then she's sort of like, well, why even try? Because, I'm not going to to do that. It's going to be really hard for me to do that, and no one's going to give me that every single week. So kind of working with someone to sort of help you and her to understand how these things...
all happy faces isn't the bar, right?
If that's not really where she's able to achieve at this point, then yeah, that's going to be really hard, and she's not going to try at all. You're going to see more bad behaviors probably than good in some cases.
Okay. Thanks.
So our son is 9 and doing very well, and we put him on a few different medications, done tremendous, amazing things for his schooling and really him in general. And the one question I have is, it's not a big struggle, but it can be a disadvantage. How do they choose their obsessions? How would you, I'm not going to do the voice because I don't want to embarrass myself, but he's obsessed over cats. We got an outside and an indoor cat. And every morning he'll wake up and call their names out like a rooster in the backyard and waking up, everybody around him. And it's not really danger, it's not anything that hurts anybody, but it's just a kind of a bad habit and a bad obsession. And then, he'll carry around stuff that he's had 10 years ago. How do they just switch from obsessions? And is there a way to, obviously we've ignored it and said, well, call out the cat's name all you want, but he's still really obsessed with it. Is there a way to kind of turn him on to something different? I hope I'm making sense in that. And I don't even know if there is a real answer.
Hey, Mike, do you want to just give them a little more background about some of the earlier experiences you had with Zion? How far you've come along?
Zion has autism, and we actually found out from the conference 4 years ago, and he obviously has Jacobson syndrome, and he went to an ABA center for a year, and we recently had a huge move. We moved 1,200 miles away for his well-being, and he has done amazing in this year. I mean, the kid is integrated in his classroom, a regular classroom, has very few specials during the day of special ed. He's with his regular peers. The peer modeling has been 100% amazing and life-changing for him. He is anything but antisocial. Everyone in the school knows him, loves him, and he excels to the highest degree possible. The obsessions, I'm just asking for our own good and our own sanity. And he does have, Charity's right, he does have his obsessions at school of, where's Jess, where's Mr. Jesse at, the janitor, where's, Miss B at, and where's my friends at, and why am I not there? And he really, really is doing fantastic on this little experience that we've had with them in the school system. It's just the obsessions. I just wonder sometimes if there's a way we could just, not flip the switch off, but just turn them on to something else casually in a way that could excite him. Obviously, we know, the more excitement we use in our voice, hey, you want to play with your leap pad, you want to write a note about your day, you want to, talk about this or that, but there's just times that I just wonder what goes on in his brain that just flips that. Is that the familiarity of like something he remembers 10 years ago with that certain toy? Is it the cat is just new and knows that the cat loves him no matter whether he yells, screams, rolls around, or whatever it is. So hopefully that's enough background information. He is on Risperidone. That's the one thing that we've added recently. And he's on Paxil and Intuitive. And that combination there has really done really, really well for him.
Well, that's great to hear. No, that's great to hear. I'm glad you asked him to give us more information, because it's kind of exciting to hear your son's, and he has a great name, a unique name. Yeah, it's really great. You started out by saying, does he choose his obsessions? Well, the unconscious is alive and well in all of us, including our children. No, I don't think he chooses those obsessions. Most of the time, why they happen, it's conjectural. It can't be certain. For the rooster crowing about with birds, cats. It was cats. You have to choose one behavior that you might want to try to modify, just one. That's kind of a general principle in behavior modification. And I'd be interested to see what my colleagues think of that, but you've tried to ignore it already. You said that, and that would be the first thing that I'd recommend, just ignoring it. And it may take days or weeks or more before it has an effect, but he may be getting some positive reinforcement.
I'm worried about it. Maybe that's comforting to him, and we don't want to take that away from him. I didn't really mention that, but we are worried about that.
You're worried about what?
Like that he's gaining something from it, from going out and seeing.
Oh, I see.
Calling the cat.
I see.
You get a dog even, because we're worried that he'll become obsessed with the dog in a bad way and start imitating the dog. The kid walks around acting like he's cleaning himself because he loves that cat.
But it makes him happy, and you don't know if it really is something that he needs on the inside. We don't.
Yeah, see, what I'm hearing is there's a lot of very positive things going on with your son, and you don't want to kind of shake things up too much, because you may substitute one difficult behavior for another and get a more difficult behavior. So I think you have to decide, how far you want to go with this. There's certain behaviors I think you just have to accept. If it's waking up the neighbors as well as you have to try to change it. Maybe get a rooster. Do you guys have some thoughts?
Oh, yeah. I think these things are really challenging, and I don't do therapy and intervention, but my colleagues do, and I know that they've said that it's really difficult to change these obsessions for all the reasons that you've explained. When they become disruptive, and it can be disruptive not only for you, but in terms of how it's affecting his interactions with other people. If he does some of this stuff at school and other kids are, kind of not wondering why he's doing that, and it might interfere with his ability to function as well as he might be able to, then trying to modify those behaviors is, probably the best you can do. From lots of the kids that I see, they don't necessarily do it for a lot of social attention. It really is, it's something that makes him happy probably, and it's become a routine for him, and and it kind of just reinforces itself over time. So trying to modify the aspects that are harder for you to kind of deal with and trying to redirect him into other things is usually what we try to do. Do you have somebody that's working with him outside of the school that you can consult with? And
He's on a pretty strict regimen, not only medicine-wise, but he goes to the CARES clinic at Texas State University, so he's getting APA, he's getting extra speech, he's getting lots of services in school. He has a lot of behavioral plans in place at school, and he's doing exceptionally well in school. It's just these weird quirkiness that, even since the risperidone, he's now picking his fingers like obsessively lately, and we have to cover him with Band-Aids. And at first I thought it was the risperidone causing more anxiety, but his behaviors have been, it was like night and day with the risperidone. It has just been, if I would have known this 5 years ago, I would have done this. You know what I mean?
What behaviors do the risperidone help with?
Since he's been on the risperidone?
Yeah.
He's picking his fingers till they bleed, which I think is...
No. What behaviors did he have before that were risperidone benefited?
It was anxiety, it was defiance, serious defiance, his mouth, when he, instead of acting out aggressively, we went through every season that we could possibly go through with him. He has been physical in the past, there's been those, but it's more his mouth. Like, he will say terrible, terrible things. And so when we use that as more of an example of his defiance, that's when he got put on the risperidone. And it's been pretty new. It's a new regimen. But it has been amazing. He's focusing in school. They can keep him at an attention span of about 40 minutes. Things that he's testing at a first grade level in reading, which I would have, that's just a couple years behind, so I don't know. It's just learning to deal with those exceptionally odd moments where, I heard somebody talking about even overly friendly. That's him. He is overly, awkwardly friendly, wants to wave at every stranger. And I gave up on teaching him that because I don't want him to not be friendly. I want him, he's a really unique case.
yeah, I think that since you are getting other services outside of the school, you really need to talk to the therapists that know him best and to what degree they understand these complex behaviors. If they're not seeing them in the clinic, for example, talking with them about what's going on at home and asking them if they can help you develop some sort of an intervention. And again, starting with the one thing that seems to be sort of the hardest maybe, or maybe the thing that you think you can have a bit more success with, and see if it spills over to other things. Yeah.
We should probably maybe about one more question. Two more. We have 2 minutes. Okay. Is there anybody on the live stream? All right. Why don't we finish up? One more. You guys can flip a coin.
My question is about fear and anxiety. He's really sensitive to light, sounds, any kind of stimulant outside. He's getting worse. He thinks that before it didn't affect him, starting to affect him now as he's getting older. So when is the time to decide, maybe, because I'm really resistant to medications, when do I know, okay, let me try this? Is there any time or any sign that I can use to move forward? Because it's getting worse. He's always covering his ears, worse than before, because he always do that, but now it's getting worse. Any kind of stimulate, like yesterday he was in the childcare, I have to take him out. And he was sitting in the floor, covering his ears, because I knew it was a lot of sounds there, and that bothers him. You know, what can I do? Because that's not, you know, I cannot control the environment. Sometimes I have to leave, because I know that the place is not good for him, but he needs to learn how to deal with that too.
You know, if you came to me with this concern, I would plan to spend more time with you to understand your son more. I mean, I could give some response, but I would need a lot more information. Just superficially, it sounds like he has a lot of excessive sensory stimuli, as we heard, that has now become one of the characteristics in the autism diagnosis, in the DSM-5. And it's usually the occupational therapists that have developed models of treatment for those hypersensitivities. And that's one thought. Although certainly, you know, ABA methods with behavior modification folks might be helpful too. On the other hand, there's a lot that you said that suggests anxiety is the underlying feature. And how old's your son?
15
Yeah. And what's his cognitive level?
is moderate, severe.
Right, right. Now, I'm asking that because, you know, there's two evidence-based, meaning well-researched treatments for anxiety. One is cognitive behavioral therapy, which is a form of psychotherapy, and the other is medication. Now, usually with cognitive behavioral therapy, you have to have a level of cognitive ability to work with a therapist in that.
We tried that before.
So that may be very difficult with his, you know, intellectual issues. But there are medications that are specifically targeting these kinds of behaviors related to anxiety. And again, as I've said before, I appreciate your trepidation, your fears about starting these medicines. But again, if you can find a physician with experience, that'll start low and go slow. Like you've heard from a couple of people most recently, you know, it's not a miracle, I hate to say it that way, but medicines in the right setting can really turn around these behaviors for the better.
Thank you.
All right, why don't we keep passing this?
Paul, if I could say one thing.
Okay, just one. You can say two.
By profession, I'm the executive director of a nonprofit community mental health center and area agency for developmental disabilities in New Hampshire. So I have the opportunity to spend lots of times with families who don't have kids with Jacobson. It's wonderful to sit here and listen to such courageous people. You are inspirational. It's wonderful that you're able to say things to people up here and bum them out. I get to laugh at that. You don't, but this is our lives, and your empathy and support is really most appreciated.
Yes.
Really, what I came to tell you is that the Padres got no hit today by the San Francisco Giants. I have a job where I have to deliver bad news often, and so I felt it was my role to give that information to you.
Do you want to follow up on that comment, Marty? I'll let you. I think Marty will give one brief comment. He has a little insight into the Padres. And then how about we say we reconvene at 3:45, so we're running a little behind, but I think we can cope with that. Is that okay, Jessica? Okay.
Well, Well, briefly, I'm certainly not an athlete, nor is my wife, but there's a recessive gene that came out in my first son, who was quite an athlete, and he now works for the Padres in the front office and manages. So I'm very sensitive about any negative comments. But I have to balance that to say, remarkably, the Padres, which have been close to being in the cellar, won 2 games against the Giants, the San Francisco Giants, who are stellar this year, and how they did it. I mean, I watched those games on television. They're in San Francisco. It was amazing. So, you know, life is one of balance.